My name is Allison Eckerd, and I am the student delegate for the North American region. And this is, I'll let you introduce yourself.
Hi, my name is Bronwyn Landless, and I am the regional liaison for the World Federation of Music Therapy for the North American region.
All right, so I'm going to ask you a couple questions about our region so we can get sort of a feel for what it's like practicing and learning in our region.
Okay.
So to start, can you tell us a little bit about what type of clinical experiences students get while in school?
So students in school in the United States receive clinical experiences both at a practicum and an internship level. And so in practicum, they are highly supervised all the time, and it would be the equivalent of maybe 1 to 4 hours at one site, maybe once a week, maybe twice a week. And during that time, they would be supervised. They would go from observing clinical work by a board-certified music therapist to then co-leading with that therapist and then doing their own work as the therapist supervises them and then provides them with feedback. That would be clinical training before they branch out into an internship. Internship is 6 to 9 months of full-time work with a clinical supervisor who is a board-certified music therapist. Some of the areas that students are able to receive experience, clinical experience, include preschool, early intervention areas, schools, medical settings such as hospitals, psychiatric facilities such as psychiatric residential treatment facilities, nursing facilities, private practice, community centers, and also hospice, so end-of-life care.
All right, thank you.
Mm-hmm.
So for number 2, are there any culture-related skills which students are expected to learn in the classroom before they go out and start working professionally?
Absolutely. So we work very much towards cultural sensitivity. So it's about fostering a sense of openness and humility in our students, where students are able to locate themselves in culture and then also show respect and understanding for people of other cultures. So we teach students to ask questions, to be open, to be humble, and also we work with them on locating themselves in culture.
Wonderful, thank you.
Mm-hmm.
And finally, are there any cutting-edge ideas or practices in our region right now, and are the academic programs teaching it?
So I'd like to speak a little more to cutting-edge teaching practices, if I may.
Absolutely.
And so some of the teaching practices or trends in teaching in the United States at the moment include something called an interprofessional education. And interprofessional education means that we are working together with other disciplines to work towards the same goals. And what we're doing in education is providing more and more opportunities for people from different schools and different healthcare professions to work together as students already, so that they can then generalize that into their professional work. We're also working towards immersion learning, and so in immersion learning, students are getting hands-on experience working with simulation patients who could be actors or who could be their classmates acting as patients. Or at Shenandoah, which is the university where I am a professor, we use virtual reality and we're able to immerse students in the therapeutic process through 360 videos that have been taken of real-life therapy sessions. So those are some of the teaching cutting-edge practices that are happening in the States and our region.
Wonderful. Well, thank you so much for meeting with me and giving a taste of what it's like to work and learn in our region. And so thank you for watching.
Take care.